Hey guys, it's Thursday, January 23rd, 2013, and this is going to be my update from my doctor's visit plus my 1 year changes with my LapBand stats. So I will do all that first. So January 21st, 2013, I had my LapBand placed. I had my LapBand placed, and then January. So yesterday was my 1 year mark. I went to my weight loss surgery clinic along with my friend Ginger Harada. She's in town and she went with me. And so yeah, I got my labs and stuff. And with my clinic, I'll actually talk about the clinic in a second. First, I want to tell you the changes in my 1 year LapBand journey. My total loss was 55.6 pounds. So I'm very ecstatic with that. In 1 year, I lost 55 pounds. That's amazing. So I started at 226.6 last year and 171 exactly. So can't beat that. Throughout my year, I had 13 gains in these 52 weeks. Most of them were excused. Well, not excused. I knew what happened. There were like 2 or 3 that I really have no idea why I gained. Yeah. Hi, Ginger. She just got out of the shower. I'm filming. Look like you're fitting in a normal towel. Woohoo, NSV! And then, so I had the 13 gains. I did do a scaleless challenge throughout my first year. And if you guys know me, you know I'm a daily weigher. I do not let the scale determine my mood. It just tells me how my day is going to go food-wise. If I need to cut back calories, if I need to add calories, if I need to add more protein, more liquids. It helps me see how I'm doing day to day. So those non-scale challenge, it really kicked my butt because I didn't see the results of what I was doing. So therefore I really didn't care that much. And it's weird to say that, but that's how it was for me. So I know I need my scale in my life. I had, and that's the only time I ever missed a weigh-in. There is only one weigh-in. I do not know why I missed. I cannot think of if I was on vacation, which I went through my calendar. I don't know why I missed a weigh-in, but I did. So there's only one weigh-in I missed that I counted in there. So yeah, I mean, of course there were some I missed when I was on vacation, but there's the one that I don't know. I don't know. For my first year with the LapBand, I never vomited. I gotten stuck a few times and that passed fairly quickly. I've never been stuck to where it hasn't passed, and where it's passed fairly quickly, like within 20 minutes is my longest stuck episode. I did have some PBs. I PB'd 7 times this first year, which I know it's not a lot, but they were scary to me. And I have got to say, the further out I'm getting, the more harsh they're getting, because it's a lot of user error. Like I wasn't chewing my food correctly and it bit me in the ass. So a year out, I still have to remember chew, 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 chew. But changes in my clothes, my shirt sizes started at a large, extra large, depending on who it was. And now I'm in usually all smalls now. There are mediums I still wear, and so mediums with smalls. It's amazing. My pants, I don't know, I can't remember my jean size per se. I want to say I was an 18 or 20, and now I'm in 12, 14s. But my pants, like workout pants or yoga pants, I started in a large, and now I wear smalls in those, and that is just amazing, guys, and it's so weird to shop still. I don't know when that will happen. So, at my doctor's office, we talked. I had a list of questions for him. It was really cool. Ginger was there, and so we were able to watch my fluoroscopy, bring it up and watch it again. Everything looked great. Everything looked fine. The fluid passed beautifully, they said. My band is in perfect placement still. There was no worries about that, no issues about that. So yeah, I also went to him with a list of doctor's questions for him. And so, like, I just had some really weird and kind of newbie questions still, but like I had to like, if you could become tight after having a fill level for 3 or 4 months. And he said, yes, it's possible, but usually it's due to you irritating your pouch and the skin around your pouch due to bad eating. I asked if I could develop night cough like months after a fill, and he said yes. I was just being a hypochondriac when I thought I had night cough. It was a change in weather thing because I didn't have any other symptoms and my band is perfect. So, I mean, but it was a concern of mine. I was waking up coughing, but it's also the weather was changing and there were allergens in the air, and I changed my sleeping pattern, and so I don't have night cough, guys. I asked about a port revision, and I showed him and I showed Ginger my port flips over. Whatever they attached it to is dissolving. It was probably just a big old fat pocket, but it's dissolving. So I asked about a port revision because my port, he sits up sideways whenever I'm laying down. And then I can flip him all the way over so that way the back side is facing upwards. I can't like rotate him, but I can flip him side to side. More like front to back. And he said it's not uncommon, but it's not common. So it was a possibility. I do not need a port revision. He said as long as they can turn it and access it to give me fills and unfills if I need them, I am fine. If it gets too painful, which sometimes it does get painful, and it's starting to itch again like healing because every time it moves or I flip it around like that, it's breaking up scar tissue that's trying to build around it, and therefore that itches again. So he said as long as I can deal with the pain and everything, it'll be fine. If it gets to where it is totally unbearable, we'll go ahead and do a port revision, and they'll give me the small port. I have the normal one now, and as it is right now, it's starting to poke out in my clothing. You can see it. So if I ever wanted a small port, we can change it over and get that surgery done with. I asked how much more weight I should be losing at the clinic, how much more they want me to lose. And we were talking, and he said I have surpassed all of their LapBand expectations, that I do not have to lose any more weight. I want to go 40 more. So that was pretty awesome to hear. He said, because I was asking about port vision being too tight, vitamin levels and issues and stuff like that, and he said, I don't worry about you. He's like, you are one of the best LapBand patients we have. He's like, you're the last person I ever worry about not following the rules. So that was really great to hear that I'm a good little student. So yeah, that is what I was doing. I asked for my lab results. I didn't get a printout. I would have liked one, but I didn't feel like asking for one, so I'll probably get it next time. But my labs were perfect. Everything was in normal range. Actually, my calcium was a little high, which surprised me just because I drink a lot of dairy. That's why it's so hard for me to take my iron. A lot of dairy. So 3 days fasting off my vitamins and minerals and supplements, and my calcium was still high. So that shows to me that I'm doing fine on my calcium as is. He said my iron was good. It was almost borderline high. It was on the high end of normal. And I asked him if I really needed my iron or if I could cut down my dosage. And he said I could take my iron every other day because the constipation that comes with iron, at least for me, is fucking painful. It hurts. Hard poops are not fun. Not fun. I also asked about if I have to have knee surgery. I go to the knee surgeon today. But I asked if that is a necessity, if I need to get an unfill. And he kind of looked at me like, why? And I told him anesthesia makes me sick. Like, it makes me violently vomit. And he said, yeah, get a complete unfill. And then I asked how soon could we get my level back up to where I am at. And he said, he's like a couple weeks after surgery, go ahead and come on in. And I was like, are we going to do the small fills and work my way back up? Because that's going to take a long time. I didn't get to my fill level where I'm at now until 10 months. He said no, they would be not very aggressive, but like my first fill would probably be like anywhere between 2 to 4 cc's, and then we'd probably do 2 cc's after that. And he wouldn't make me wait the 6 weeks to come back again. He said we could probably do you every 3 weeks. If you feel like you can handle it, we'll do it, because it will just be for knee surgery that I'll get unfill. And then I want to get my fill back, at least some restriction, so that way I'm not going crazy. Yep. I also asked about a fill now because I was in my green zone, but I think my green zone is slipping away, because in the morning I do a regular 6-ounce yogurt plus 4 ounces, 3 or 4 ounces of Faye, plain with a little bit of honey, and my protein granola. And all together it weighs out to be about 7 ounces total, I think. It's 7 ounces. I don't know what size. I don't know. I just buy a flavored yogurt. I do plain yogurt, honey, granola. And that is usually has been my breakfast lately because yogurt is very much a slider food for me. It doesn't keep me full long at all. This concoction I make does keep me full for about 2 to 3 hours. And I asked him, I'm like, I know you guys want me to stay to 1/3 cup portion, but if I did that with this, it wouldn't last at all. And he said, you know, that's fine. He's like, yogurt, it's a soft food. It's fine. He's like, but how's your chicken and stuff? And I was like, no, chicken's still staying at like 4 ounces. I still keep my chicken. So my firm protein is where it needs to be still. I could get a fill if I wanted, but that all depends on what goes on today at my doctor's office. So I will let you guys know. I will do my 1-year post-op questions from Brad and Jen from their video later tonight, maybe. All right, talk to you guys later. Bye.